Hello students, welcome to Distinction Learning Platform, and on this platform you'll find revisions, tests, quizzes, explanation to difficult topics, a lot of stuff. So before we begin our lessons, make sure that you subscribe so that you can be updated with all upcoming videos. To make the story short, let us begin. In this video, we're talking about inflammation. Remember that we're talking about the chemical mediators. It is under inflammation. Okay, so make sure that you watch the video for acute inflammation so that you can fully understand. Now, if we talk about chemical mediators, we're talking about things that makes possible inflammation to be there, okay? Because inflammation can't just happen on its own. There has to be something that is making sure that inflammation is what is there. So what are those things, okay? So chemical mediators, they are further categorized into something that is very, very important, okay? Two major subcategories, okay? What is that? There are some chemical mediators that can come from what? Cells, which we call cell-derived mediators. And there are some chemical mediators that we'll talk about from another video, which they come from what? The plasma. We call them plasma-derived chemical mediators, okay? So we'll talk about them. So these are very, very important things to talk about. Chemical mediators are very, very important. Why is it important? Okay, although it's very, very difficult for someone to understand about chemical mediators, but I recommend so that you know why. The reason why, because if you talk about the pharmacology, okay, aspect, we are going to find out to say the treatment of fever, pain, is because of someone who understood about what? Chemical mediators, okay? The NSAID, non-inflammatory type of drugs, okay? Those NSAID like in aspirin, ibuprofen, those they are going to antagonize something very, very important under what chemical mediators. So it's very, very important to understand about what chemical mediators. Okay, so let us begin about these chemical mediators. Okay. So now, chemical mediators, we are saying we have cell-derived mediators and what? Plasma-derived type of what? Mediator. So we'll start with what? We'll start with mediators that are coming from what? Cells, okay? So we've seen these cute cells, these two cells. We're going to understand something very, very important, okay? And under cell-derived mediator, there is also another thing that is very, very important to understand before we begin. So cell-derived mediators, there are two important components that you need to understand. What is that? There are some mediators that are already formed in the what? In the cell. We call them what? Preformed mediators, okay? Preformed what? Mediators. These are already formed already. Basically, these are fast mediators. The reason why they are already made, if the cell is stimulated, then it's going to what? Start releasing, because they are already what? Made. These are called preformed cell mediators, okay? Derived cell mediators. Then there's also another point where you are going to what? To form what? Mediator. You are going to synthesize. You are going to make what? The mediators, okay? We call them what? Synthesized cell derived mediators. So let us talk about them. So we are saying there are two types of cell mediators that you need to what? Understand. What is that? The first one is what? Preformed. So let's just say preformed. Preformed, basically they are already formed, and what? Synthesized. So we'll talk about this. The one that they can be made by the cell. Okay. So preformed, they do not what? Take longer to start being produced, because they are already formed in the what? Granules. Synthesized, the cell, if it is stimulated, it will start what? Making them. Okay. You need to understand that. Now let's talk about the preformed mediators. What are those mediators that makes inflammation to be possible? What are those preformed mediators? What are those? So basically there are two important preformed cell-derived mediators. What are those? There are two. We call them, in general, we call them vasoactive what? Vasoactive amines. So in general, these things that we're going to talk about is, we call them what? Vasoactive amines. Very, very important, okay? These already form the mediators. We are call them vasoactive what? Amines, okay? There are two. Basically, so you don't even need to what? To worry yourself or to stress yourself. They are just two under vasoactive amines, okay? What are those? There is the first one, which we call, the most important one is what? Histamine. Or sometimes you call them histamines. Whatever your pronunciation, okay? Me, I like to calling them histamines. Okay, and there's also another one which we call serotonin. Okay, serotonin, this one. So there are basically two vasoactive amines. Okay, what are those? Histamine and what? Serotonin. Okay, let's start with histamine. Okay, you've seen this cell. Okay, this is a nucleus. Remember that these are what we call this. This in blue, those smaller circles. What do we call them? We call them what? Granules. Okay, what do we call this? We call them intracellular granules. So let's just call them granules. Okay, these are granules inside there. And inside the granules, there are what? Preformed cell-derived what? Mediators like what? Histamine and what? Serotonin. Okay. So now, what did I say? For these granules, for this cell to start releasing these granules, what do you think? Do they start on their own? No. There has to be something that is stimulating the cell to start what? Producing those what? Cell-derived mediators, or like preformed cell-derived mediators. So there has to be something. So remember the causes of what? Inflammation. What did we say? We talked about what? The necrotic necrotic what? Cells. We talked about the pathogens. We talked about the immunomediated type of what? Reaction. You need to watch that video so that you see the causes of the reason why these cells are producing what? Producing these what? Preformed what? Granules. So it's because of that. So let's just pick one. Let's just say trauma. There is trauma here. Okay, there is trauma. Maybe the bacteria, whatever. So let's just say there is trauma. Trauma is injuring this cell so that this cell can start producing what? These preformed what? Granules. So let's pick here. So these are preformed what? Granules. So they are going to what? Fuse with a cell membrane there. Okay, it's going to fuse the cell membrane so that now we can release them here outside. Okay. The question that you can ask is that what is this type of a cell that's going to release histamine and what? Serotonin. What is that cell? What do we call that? We call it what? We can call it a lot of names. These we can call them what? Basophils. Okay. So because in the basophils that's why you can find what? Histamines. What else? The major one. Let me write it in red. Okay. This one, mast cells. Okay. So this can also be mast cell. What else apart from that? It can also be neutrophils. It can also be endothelial cells. Okay, a lot of what? Types of cells that can release what? Histamine. But if we talk about histamine, major important cell that can release histamine is what? Mast cell. So this one. Make sure that you know if you are talking about the histamine, basically know about what? Mast cell. It's the one that's going to release massive of what? Histamine. And we talk about, if we start talking about what we call hypersensitivity reactions, we'll come and talk about the type 1, where it is related with what? It is related with what we call asthma. Okay, we'll come and talk about it. Don't worry about that. Okay. So now, since we know about that, now what else are we supposed to know? Okay. Now, what is the function of this histamine? What is the function of that? So histamine, we are saying, what did we say? So where can you find them? Found in what? In mast cells. That is what we said. Okay. But basically, you can also find them in what? Basophils. Also platelets. Okay, you can find them in the what? Platelets. You can find them in what? Endothelial cells. Okay, but majority I'm emphasizing on this mast cell. Okay, now what is the function of histamine? So the function of histamine is what? It is to promote what we call, the first one is what? Increase in what? Vesicular permeability. Okay, so it promotes what? So this histamine, what does it promote? So it promotes what? Permeability. So it increases what? Vesicular what? Permeability. Okay, what is the other important function? Increases what? Vasodilatation or dilation. Increases vasodilation. What else? Also increases what? Secretion. Okay, let me just say bronchosecretion. There are a lot of what function of histamine. Okay, I'll talk about that. Okay, and also increases what? Bronchoconstriction. So you've seen the function of histamine. You can just pick one. So, but major important thing is what? Increasing what? Vascular permeability, where the fluid, the edema will start what? The fluid will start leaking out from the blood vessels going into what? Interstitial space. Okay, that is it. The reason why there is increase in vascular permeability. What else? Vasodilatation. The blood vessels will start what? Dilating. Okay, that is one of the important factor when you talk about what? The markers of acute inflammation. Okay, vasodilatation. Then also bronchoconstriction, so bronchosecretion. If histamine goes to the respiratory tract there, it will start telling the respiratory type of what cells to start what secreting what mucus. No wonder if you talk about asthma, come and talk about that secretion of mucus and why it is it problematic. Okay, we'll come and talk about that. There is also bronchoconstriction, where the bronchos, they are going to constrict, narrowing like that. Okay, so that is the effect of what histamine. It has a lot of effects, very important effect. Okay, and make sure that you know where you can find them, and also at least a certain function of what histamine, and it is one of the what preformed what type of cell derived mediators. Okay, then let's go. Serotonin. Serotonin, again, if you look at serotonin, the other term that they use is what? 5-hydroxytryptamine. So you need to know also the other name in case they used other name. Okay, this one is also called what? 5-hydroxytryptamine. Sorry, tryptamine. Sorry. Okay, 5-hydroxytryptamine. Okay, 5-hydroxytryptamine is also called what? Serotonin. Basically, let's just call it serotonin. Okay, instead of making our lives hard. Okay, so that is serotonin. Now the question is, where can you find serotonin? Basically, this one it has a limited location where you can find them. The types of cells that can produce serotonin. So let's just list 3. So where you can find this, you can find them in what we call, the first one is what? Platelets. Basically, this is the most important part where you can find them. Okay, platelets. But what is the other ones? Okay, the other ones is what? You can find them in what? Neurons. Okay, and if you talk about the gastrointestinal tract, they can be found in what we call enterochromaffin cells. Okay, enterochromaffin cells. Enterochromaffin cells. Okay, why do you think they can be found in the neurons and also in the enterochromaffin cells? So the reason why they can be found that because serotonin is one of the what neurotransmitter. It also acts as what a neurotransmitter. If you talk about the GIT or gastrointestinal tract, there it acts as what? It acts as a neurotransmitter, and it's going to regulate what the production of hydrochloric acid. It's going to regulate what GIT motility. Okay, you need to know about that. Okay, that's about in the neuron. But what is the most important function of serotonin apart from the GIT motility? But being it like a neurotransmitter, what is the other thing? The other thing is this. Okay, so the other thing is this. Oh my God. So the other thing is this. Okay. The other thing is that since it can be found in platelet, what do you think it's going to do? It's going to promote what? Platelet aggregation. So we'll come and talk about the hemostasis, okay? How platelet aggregation is going to happen when we start talking about what? Hematology, okay? So platelet aggregation, okay? So where the platelets will come together and aggregate, okay, so that maybe thrombus can be formed like that, in case someone has injured himself or herself, okay? What else? This one is going to promote something. Remember here we had vasodilation, but here it's going to promote what? Vasoconstriction. That is the major important thing that I wanted you to know, okay? This one is going to promote what? Vasoconstriction. It has the opposite function with histamine, okay? This, they promote vasodilatation, where the blood vessels, they're going to what? Enlarge. Then the serotonin is going to promote what? Vasoconstriction, where the blood vessels, they're going to what? Become smaller like that, okay? And we'll talk about the drugs, because serotonin is one of the important also substance or neurotransmitter. And as under pharmacology, we'll come and talk about the drugs that are going to antagonize serotonin, because of in case of hydrochloric acid, those people that have got what, gastric ulcers, it's very, very important, okay? As well as histamine. So histamine can also be found in the what, in the stomach there, okay, on the gastric cells there. It can be found there, histamine receptors there, and we use it under pharmacology as what, something that is important under clinical things, okay? So come and talk about that, don't worry, okay? So this is under what, preformed cell derived what, mediators, okay? You need to know about this. Very, very simple. In case they ask you anything, at least you can say something, okay? Now let's go to synthesize. I said there are granules that are there are some mediators that are preformed, but here we need to synthesize. That's why a problem is now. So here, that's why now things are getting interesting, okay? So make sure that you understand now, pay attention here, because that's why a problem here, and they like asking about this pathway that I'm going to talk about, okay? So synthesize. So we're going to talk about the arachidonic acid production, and as well as what, we'll talk about the chemokines, okay, and the platelet activating factor, okay? Those are the very important what substances that are going to be synthesized from the what, from the cell, and the under cell derived what, type of mediators, okay? They come from a cell. So the moment you just hear cell mediated, basically those mediators, they come from what, cell, okay? Now let's talk about the synthesized one. So synthesized one, the cell is going to make them, okay? These cell mediators, the cell is going to make them, not already formed, but it's going to make them. The first one that we are going to talk about is what? Arachidonic acid. Arachidonic acid, okay? Now arachidonic acid, where can you find it, okay? Basically, you can find it in a lot of what, as a lot of what, cells, okay? You can find it in a lot of cells, but basically, where in the cell, in the what, cell membrane of those what, cells. You've seen this cell membrane, okay? So you've seen this phospholipid bilayer, this one. So that's why you can find the arachidonic acid here, okay? That's why you can find them in the what, cell membrane. It is embedded in the what, phospholipid, in the form of what, esterified form, okay? So basically, you don't need to know that, okay? So now this cell membrane, okay, is going to be broken down because this cell has been activated. Remember that here we had trauma, okay? Something that's going to activate this cell, maybe trauma, bacteria, anything. Also here, bacteria, anything that's going to activate this cell. This cell can be what? It can be a leukocyte like macrophages, neutrophils, basophils, xenophils. It can be endothelial cell. It can be a platelet. All those things can be like that. Those have got what? Cell membrane. On the cell membrane there, that's why you can find what? The arachidonic acid. So here on the cell membrane, now the question that you can ask is that, how is this arachidonic acid going to be removed from that cell membrane? Okay, you need to ask that, okay? So for it to be removed, okay, there has to be a stimuli. The stimuli is there because of maybe trauma, because of trauma, maybe because of what, bacteria, toxins. Then they'll come here and they activate this one. Then there is a certain enzyme that's going to what, to remove the arachidonic acid from what, from the cell membrane there. What do we call that? We call it phospholipase what, A2. What do we call that? So what do we call that? So we are saying phospholipase A2. So phospholipase A2 is the one that's going to what, break down everything that is attaching to the what, arachidonic acid, so that it can just be alone, okay? So it's going to break down the component of the cell membrane there, so that we can now have arachidonic acid, okay? And you can ask yourself, why is arachidonic acid? We know that quite right is coming from the cell membrane, okay? But where does it come from initially before embedding itself as in the esterifoid, in the cell membrane? Where does it come from before going into the cell membrane? It's come from what? Diet, okay? It comes from what we call, they call it linoleic acid, something like that, okay? That's what they call it. So it comes from what? Diet. Then after coming from that, then it's going to be used to be embedded in the what? Cell membrane, okay? Now we know that after this cell is activated, the phospholipase is going to be activated. Phospholipase what? It is going to be activated, and it's going to break down the component of the cell membrane so that it can use what? Arachidonic acid, okay? Now, arachidonic acid, you need to understand something. Before we go into the details here, so arachidonic acid, so this arachidonic acid, we're going to say A. So this arachidonic acid, okay, it has what we call the product. So the product of arachidonic acid, what we call them? We call them arachidonic metabolites. Or the other term that they use is what? Eicosanoids. So what am I saying? So I'm saying before we go any further, we need to know what comes out of the what? Arachidonic acid for the overview, okay? What comes out here? So we call them what? Eicosanoids. Eicosanoids. Or we just call them arachidonic acid what? Metabolites. What are those? What are those? So they are basically what we call prostaglandins. So the first eicosanoid is what? Prostaglandin. So we're going to talk about what? Prostaglandins. Okay. What else are we going to talk about? We'll talk about, apart from prostaglandins, we'll talk about what? Lipoxins. Okay. We'll also talk about what? Leukotrienes. You've seen that? So these are the very, very important eicosanoids that will come out from what? As the metabolite of what? Arachidonic acid. Prostaglandins, lipoxin, and what? Leukotrienes. These are very, very important. You need to understand them, okay? Now, the question is, how do they come about, okay? You need to understand the pathways because you're going to be what? Examined on that. So, what are those pathways? Let's start with this one. So this is arachidonic acid is there, okay? Then it's going to be broken down into something by something that we need to know, which we call cyclooxygenase. Cyclooxygenase. So cyclooxygenase, we call it COX. Okay, so let's put in bracket as COX. Okay, cyclooxygenase. So this arachidonic acid, the moment it is just there, okay, I'm not saying it will go outside there, it will be within the cell there, okay? It's just broken down like that. So I'm just saying like this, okay? This is arachidonic acid, okay? Then it's going to be broken down by what? COX like that, okay? COX into what? Prostaglandin that we need. So we need to know that COX is related with what? Prostaglandins. So it will break down this arachidonic acid into something important. You need to know this, okay? It's so interesting. This one is what we call prostaglandin what? G2, okay? Prostaglandin what? G2. That's the first what? Metabolite is going to be what? Synthesized. But this prostaglandin G2 is not that important. It doesn't do a lot of things. It's going to be further converted into something. Okay? It's going to be converted into this intermediate also, which is also important, which we call prostaglandin what? H2. Okay. So prostaglandin G2 is coming from what? It's coming from arachidonic acid because of the effect of cyclooxygenase, which is also called what? COX. Okay? This COX is going to break down arachidonic acid into prostaglandin G2. Prostaglandin G2 is going to be further broken down into what? H2 by various enzymes that are not clinically important. That's why I'm not mentioning them, okay? Then the other thing now, from H2, that's where now all the prostaglandin that I'll talk about, they come from what? This intermediate type of what? Prostaglandin. What is that? What are those? Okay, let's start with this. This one, I like this one. We call it prostaglandin what? I2. The other term that they use is what? Prostacyclin. So prostacyclin is coming from what? Prostaglandin what? H2. We are going to have prostacyclin. Another important what? Prostaglandin. What is that? Thromboxane A2. So let's just say thromboxane A what? 2. Thromboxane A2 and prostacyclin are the ones that are going to be produced. There's a reason why I'm putting like that, because these two type of prostaglandin, they've got what? Different what? Effect. What is the other one? Okay, I know it's a lot, but you understand. It's just very simple. Another what? Other prostaglandins that are going to be produced here. Okay, these are not okay, they are important as well. So let's just name them. So there's what we call prostaglandin E2, okay, prostaglandin F2 alpha, okay. Then there's also prostaglandin what? D2. Okay, these are also other prostaglandins that are going to be what they produce these. Okay, we'll talk about the function of this. Don't worry. Okay, so now let's start with these two, prostaglandin I2 and thromboxane what A2. Okay, the first important thing is where can you find these prostaglandins? Okay, where? Okay, the first question. So for this one, you can find them in what? Platelets. So where can you find thromboxane A2? So you can find it in what? Platelets, and you can never find it in what? Endothelial cells. Very, very important. Although other cells, they can also have thromboxane, but the most important thing that you can know is what? You can find them most of the time in granules of platelets. We'll come and talk about it under hemostasis, okay? So, but basically, let's just know that thromboxane 2 can be found in what? Platelets. But what is the function of thromboxane A2? What's the function? The function of, since it can be found in platelets, the function is what? Platelet what? Aggregation. So what is the function of this? Let's just say platelet what? Aggregation. What is platelet aggregation? Basically, just making sure that the platelets they come together, and this so that maybe if there was an endothelial injury there, there will be what? Platelets plugged there so that the blood can't come out of the what? Blood vessel. We'll come and talk about it in future. Okay. Basically, let's just know that thromboxane is promote what? Platelet aggregation, and the other important what? Function, which is what? Vasoconstriction. What is the other important function of this? Vasoconstriction. What is vasoconstriction? Making the blood vessels to become what? Smaller. Okay, that is vasoconstriction. Okay, let's go to prostaglandin I2, which is also called what? Prostacyclin. In case maybe you want to know it, I'm saying the other term that we use is what? Prostacyclin. Okay, this is also called PGI2, okay, prostaglandin I2. Okay, now what is the function of this? So it inhibits platelet what? Aggregation. So this one, the function of this one was saying, okay, it's going to inhibit what? Platelet what? Aggregation. It's inhibit what? Platelet aggregation, and it's going to promote what? It's going to promote, here there is vasoconstriction, it's going to promote what? Vasodilation. Okay, these two effects are very, very important effects. Okay, and it will depend on what? On what can I say? It will depend on the type of a cell that's going to have what? It's either it's going to produce prostaglandin I2, or it's going to produce thromboxane A2. Okay, these are very, very important in what? Homeostasis. Okay, this vasoconstriction, vasodilation, platelet aggregation, and platelet inhibition of platelet aggregation, there has to be in the homeostasis state. Okay, so that there's no favoritism to say, okay, me I'll go to like platelet aggregation, or maybe I'll like more vasoconstriction. Unless there's a problem, that's when the body will favor now maybe vasoconstriction or what? Vasodilation. But normally these two, they are going to be under what? Homeostasis. Okay, now the question is, what are the cells that are going to produce what? Prostaglandin I2, because here we said it can be found in what? Platelets most of the time. But what about this one? This one can be found in the what? Endothelial cells. Endothelial what? Cells. That's why you can find what? Prostaglandin what? I2. That's why you can find much of the concentration of what? Prostaglandin I2, or synthesis of prostaglandin I2. Okay, so now let's move on. What about this? Prostaglandin E2, there is also prostaglandin what? E1, prostaglandin F2 alpha, and prostaglandin D2. What about these? You can, most of the time they can be produced by what? Different cells, like mast cells. They can produce what? Prostaglandins. What else? They can also, like endothelial cells, they can also produce what? Prostaglandins, and a lot of what? Cells like what? Neutrophils, macrophages, basophils, they can also produce what? Prostaglandins. So a lot of them. So let's just choose one. So most importantly, let's talk about what? Mast cells. And remember that also this one I2 can also be found in what? Mast cells. Okay, mast cells, and also let's say endothelial what? So that's why you can find them. Now the question is, what is the function of this? So the function of this, basically, I'll start with this one. the I2, and this is, it has what, an important function, and we are going to be what, asked about that. Okay, so what is the function of prostaglandin E2? Prostaglandin E2 is, it has some like effect or function in relation to what, pain. Okay, it's going to stimulate pain fibers so that someone now can feel what, pain. Okay, if you are feeling pain, basically you need to remember that that is the prostaglandin what, E2. Okay, what are we saying here? The most important function of prostaglandin E2 is what, pain what, stimulation. Very, very important. Okay, but all these prostaglandin, including I2, they are also important in what? They are important in what, fever. Okay, they are also important in what, fever production by the brain. Okay, very, very important, because these prostaglandins are able to diffuse into the bloodstream, and where do they go? They go to the brain. There in the brain, what's going to happen? Then there will be what, fever production, stimulation of what, fever. Okay, we need to know about that. Okay, so now since we know about that, now what is the other important function apart from that? What is the other important function of what, prostaglandin in general, except for thromboexane? What is the other important function? The other important function is what? Okay, that is what, there will be vasodilatation. Okay, there's also bronchoconstriction. Okay, so bronchoconstriction as well. Okay, so vasodilatation, bronchoconstriction, and also, okay, and also what else? And also increase in what, vesicular what, permeability. Okay, permeability, like that. So those are the function of what, prostaglandin: vasodilatation, bronchoconstriction, also increasing the what, vesicular permeability. Okay, very, very important. Okay, so those are the function of what, prostaglandin. Now the question that you can ask is that, why am I troubling you with all these? Okay, all these, because there's a important concept that you need to understand. Remember that we talked about, okay, treatment of pain and also treatment of what, fever. Okay, so the reason why, if you feel like you have high grade fever, or maybe you are having pain, what's the main reason why they give you NSAID? Okay, what's the main reason why they give you aspirin? It's because of what? If you are given aspirin, aspirin is going to inhibit what? So aspirin is going to inhibit COX. Okay, so aspirin is going to inhibit what, COX. What do we call that? Aspirin is under what we call NSAID. Non-steroidal anti-inflammatory what, drug, NSAID, okay, or ibuprofen. It's going to inhibit this COX. If you inhibit COX, you're not going to have what, prostaglandins. If you don't have prostaglandins, you're not going to have pain, you're not going to have what, fever. No wonder you are going to be prescribed what, aspirin, also ibuprofen. Now there are also other what, drugs, non-steroidal anti-inflammatory what, drugs. There are others. Okay. Now, if you look at COX, there is also another important concept about these cyclooxygenase enzymes. So COX, there are two types of COX. There is COX1, COX2, but some books also it can reach up to COX3. Okay, so COX1, basically it is a type of enzyme that is always found in the what, in the cells. It is always present. Even if there is no inflammation or there is inflammation, it is always what, present. Okay, no wonder it is called the constitutive what, type of enzyme, constitutive type of an enzyme, because it is always found in the what, in the cells. What about COX2? COX2, it is something that is inducible. It can only be found if there is what, an inflammatory reaction. You need to know that. Okay, so what am I saying? For you to remember, what I'm saying is COX. There is what we call constitutive, that is COX1. Then COX2 we are saying inducible. Why we are saying inducible? Because it can only be induced due to what, inflammation. Okay, constitutive, it is always there. It is there because of what, maintenance of what, homeostasis. Remember what I talked about here. Okay, the platelet aggregation and the inhibition of platelets, it is always there. So it's COX1 that's going to promote this and this. Okay, and basically if you talk about the kidneys as well, COX1 is there to promote what, proper tissue perfusion, proper kidney function, a lot of stuff like that. Okay, so that is COX-1. You need to know about that. Now, if you look at the side effect under COX-2, COX-2 are drugs for COX-2. They can basically like Colexib can basically promote what we call cerebral accident, okay, strokes like that. Why? Because if you prescribe COX-2 drugs, they're going to promote what? The platelet aggregation that are going to what? Block the cerebral blood vessels. If you block the cerebral blood vessels, what's going to happen? It will cause what? Stroke, okay, or cerebrovascular accident. Also some cardiovascular diseases like coronary artery diseases. No wonder COX-2 inhibitors, they are going to be what? They are going to be contraindicated in someone having what? Cardiovascular diseases like coronary artery disease or ischemic heart disease, as well as what? Someone having like cerebrovascular accident, CVAs. Okay, they are going to be contraindicated in that. Okay. They are low, they are low. Okay. What is the other pathway? The other pathway is this side. Okay. The other pathway is this side. So here we had cyclooxygenase. Then here we're going to have what? Lipooxygenase. This is very simple as well. Lipooxygenase. Okay. But basically the type of lipooxygenase that's going to break down arachidonic acid is what? 5 lipooxygenase. So this 5 lipooxygenase is the one that's going to produce something that is very important, because here prostaglandin we are done. Okay, now we need to concentrate on these two, lipoxins and what? Leukotrienes. Okay, we need to understand that. So lipoxins now, they're going to act on that to produce something important. Okay, something important. I'm just going to abbreviate this one because it is a very, very long name. HPT. Okay, HPT. And make sure, maybe if you want to remember that one, at least name your fellow students that you are HPT, so that you can remember that, okay, I'm trying to remember something about what a lipoxygenase pathway. So this is cyclooxygenase pathway, and this is what the lipooxygenase pathway. Where lipoxygenase, 5 lipoxygenase is the one that's going to act on arachidonic acid and convert it into HPT. But in full, HPT is what? Hydroperoxy eicosapentaenoic acid. That is the full name. No wonder I said it's better we just call it HPT, because it has a longer name. Okay, now this HPT now is going to be converted into something. Okay, it's going to be converted into something. Let me just say two important pathways. Okay, it's going to be converted into 2 important pathways. You need to understand about also this one. So let me just put it somewhere there. Let me just use red. Okay, so it's going to be converted into these 2 important pathways. Okay, these 2 important pathways. So let's start with a simpler one. If it is acted by what? Another lipoxygenase, which we call 12 lipo. So you don't need to master this. It's just to know them. Lipoxygenase, because they are very, very simple. Okay. If you look at HPT, if it is acted by what? 12 lipoxygenase, then it's going to produce what? This lipoxygens. Okay, it's going to produce lipox. So it's going to convert HPT. This lipoxygenase. So let's just put it. This is an enzyme. Okay, this lipoxygenase is going to get HPT and convert it into what? Into lipoxygens. Okay. It's going to convert them into what? Lipoxygens. What are the examples of lipoxygens? So there's what we call lipoxygen A4. So there's what we call lipoxygen A4. Okay, and lipoxygen B4. These are very, very important chemical mediators. Why are they very, very important? Because these are the ones that are going to inhibit inflammation. So these lipoxygens A4 and B4, these are the ones that are going to inhibit inflammation. So what are we saying? So they don't like inflammation. They are going to make sure that they will try by all means to stop inflammation. So what are we saying? They are going to inhibit inflammation. Okay. So inhibiting inflammation, what do you think? There will be inhibition of neutrophil radiation neutrophil what migration, margination, activation, a lot of stuff. So it's going to inhibit that. Okay, so those are important what substances. So like they use some initials, like if you see an initial like this, okay, if you see an initial like this, then we're talking about the lipoxins. That's from X, okay, lipoxins, okay, lipoxin A4 and lipoxin what B4. Okay, like that. So those are the initials for lipoxins. Now let's go to the bigger thing, important one as well. Let's go to this side. Yeah. So now let's say now this, if it is not acted by 12 lipoxinase enzyme, but it is just converted spontaneously into something which we call leukotrienes. Okay, so if this one, okay, there is no like the enzyme that's going to convert HPA10 to leukotrienes is not that important because it's not clinically significant. So now I'm just going to say it's going to be converted into what is spontaneous into something, okay, which is the leukotrienes. So the first leukotriene that's going to be converted into is what? Leukotriene A4. And you need to see what the difference. Leukotriene is LT. Lipoxin is what? LA, LX, okay? Make sure that you know that. So the first leukotriene that's going to be produced is what? Leukotriene A4. You need to know that, okay? And leukotriene A4 is the one that is very, very important. Remember here what I talked about. Prostaglandin H2 is a very, very important what? Intermediate prostaglandin, because from this prostaglandin H2, that's why you can have thromboxane A2, that's why you can find prostacyclin I2, then that's why you can find prostaglandin E2, prostaglandin F2 alpha, and also prostaglandin what? D2. You need to understand that, okay? Also here, this A2 is the one major important what? Something here. It's the one that's going to produce what? Leukotriene B4, okay? Leukotriene B4 is the one that's going to be produced here, and remember that leukotriene B4, it is important in what? We'll talk about the function of this, but let me just write it, chemotaxis, okay? It is important in what? Chemotaxis. Chemotaxis, okay? Very, very important in what? Chemotaxis. Okay, very, very important in what? Chemotaxis. We'll talk about it. So remember that from inflammation, what did I say about the chemotaxis? We said it is a process that is mediated most of the time by what? Chemokines. And chemotaxis is basically the process where a leukocyte is migrating toward the site of what? Infection. That is what? Chemotaxis. And it's mediated by which type of chemical mediators? Leukotriene B4 and also other what? Chemokines. We'll talk about cytokines. Okay. What else? There are a lot. Okay. Let's go. Hanging there. So if there is F4, now from F4, remember that we have B4. From B4, we are going to have what? Leukotriene what? C4. We are going to have what? Leukotriene C4. And from leukotriene C4, we are also going to have what? Leukotriene what? D4. Okay. And what else? The last one is what? Leukotriene what? E4. Okay. You've seen leukotriene C4, D4, and what? E4. These they come from what? Basically from A4. Okay, they come from there. And what is the function of this? What do you think the function of these leukotrienes? These are very, very important. You need to understand this. Okay, these are very important in what? Bronchospasm. Basically, if I say bronchospasm, it's basically I'm talking about what? Bronchoconstriction. Okay. I'm talking about bronchoconstriction. Okay, then they are also important in what? Bronchosecretion. Okay, the bronchos there, they're going to start secreting what? Mucus. They are also very important. These are the ones that are going to stimulate that. Bronchosecretion. Okay. Bronchosecretion. Okay. So bronchospasm or bronchoconstriction, just the same thing. Bronchosecretion, it's because of what? These important what? Mediators. And these are related with what? Asthma. Okay, asthma. Okay, make sure that you know that these are related with asthma. So if you are given a scenario, okay, a scenario about asthma, then they ask you to say what are the arachidonic metabolites that you are going to mostly inhibit. It's what? Leukotriene, C4, D4, and what? E4, because these are the ones that are going to exacerbate what? Asthma. So we need to give drugs that are going to inhibit the production of what? Leukotrienes. You need to know that, okay? Okay. So here we've understood about the leukotrienes, we've understood about the prostaglandins, okay? Now, since here we talked about the inhibitors of the COX pathway, okay? Here also we can also talk about the inhibitors, drugs that are very important in what? Inhibition of what? Lipoxygenase what? Pathway. Reason being because very important in what? Asthma, their relationship with what? Asthma, okay? Now, what are those drugs? So they are a drug that is going to inhibit this lipoxygenase enzyme. Okay, that's the main reason why I was talking about these enzymes. Okay, so there is a drug that can inhibit this enzyme. What do we call that drug? We call it what? Xylu. Okay, we call it xylutone. Okay, we call it what? Xylutone. So this xylutone is the drug that's going to inhibit 5-lipoxygenase what? Enzyme. If you inhibit this, you're not going to have what? Leukotrienes. Leukotrienes are very important in what? In like in the like asthma there, okay? So like leukotriene induced type of what? Asthma, okay? That's the first drug. It's going to inhibit that. The next drug that's going to inhibit is what? It's going to inhibit where these leukotrienes, the C4, D4, and the E4, where they are going to what? Like on the receptors of that, okay? What do we call that? We call these two enzymes that are going to what? These two drugs, we call them what? There's this drug which we call montelukast, okay? This one, montelukast, okay? And also there is also another one, zafirlukast, this one, okay? Zafirlukast, okay? This one, okay, zafirlukast and what say montelukast, okay? Oh my God. So these are the drugs that are going to inhibit on the where leukotrienes, these C4, D4, and what E4, where they act from, okay? So regardless of that, these they are going to help to decrease the symptoms of what? Asthma. Very important, okay? Then what else? There is also now, what if there is a situation you don't need the production of what? This, and you don't need the production of what? Cyclooxygenase pathway. The lipoxygenase and also cyclooxygenase pathway. There is a drug that's going to inhibit this phospholipase A2. What do we call those drugs? We call them what? Corticosteroid drugs, okay? What do we call these drugs? So we call them corticosteroids. Okay, what do we call these drugs? We call them corticosteroid drugs. These are the drugs that are going to inhibit what? Phospholipase A2. If you inhibit phospholipase A2, are you going to have arachidonic acid? No. If you don't have arachidonic acid, you're not going to have prostaglandins as well as what? Leukotrienes. These are also important. Wonder if you talk about corticosteroids, we call them, these are anti-inflammatory drugs as well. They don't like inflammation. Okay, no wonder sometimes they are prescribed in what transplants, okay, as well as maybe in the like inflammatory conditions, okay, a lot of inflammatory conditions like gout, okay, a lot of them, so are going to be prescribed that like that because they inhibit this type of what pathway. Now there is also another important concept that you need to understand is that, okay, there are some people that are sensitive to asthma. So you're going to be asked also like assist on that, okay? Those people that are sensitive to asthma, what do they mean? If they say, me, I'm sensitive to asthma, I have these symptoms, I'm going to have difficulties in breathing, okay? So those people, is because of something. They are very sensitive to like aspirin. Aspirin is one of the NSAID. So if you give them like aspirin, what's going to happen? They're going to inhibit these COX. They're going to severe inhibit COX pathway. So this cyclooxygenase pathway is going to be inhibited severely. And what do you think this pathway is going to happen? There is no inhibition to this pathway. What do you think? you're going to have massive increase in what? All these products, the HPTs, the leukotrienes, they're going to be what? Increase what? Increase the amount. If the leukotrienes are increased in amount, what do you think to bronchospasm is going to be what? Increased. So there will be so more increase to the what? Bronchospasm. There will be more increase to what? Bronchosecretion. There will be more increase to what? Bronchodilatation. There will be also more increase into what? Increase in vascular what? Permeability. A lot of dangerous what? Substance like effects. Okay, so those people, they are what? They are what we call aspirin what? Sensitive. So if you they give you a scenario talking about aspirin sensitive, then they ask you to say, what can you do? So me, what I can do is that if I prescribe aspirin, then they are having a lot of what? Leukotrienes. What can you do? You give them what? Drugs that are going to inhibit what? Leukotrienes, like what? Montelukast and what is Zafirukas, and as well as what? Xylitol. Okay, very important what? Things to consider. Okay, so that's why like we end from under arachidonic acid. Okay, and if you don't understand like from this, make sure that okay, you add on something. So now the last part is if we talk about cytokines. So cytokines, we'll be talking about them, so I'm just going to talk about them briefly. Okay, so if you talk about cytokines, these are basically polypeptide. These are basically proteins that are going to be synthesized by the cell. Okay, remember that from DNA and like transcription, from transcription, translation there, then there will be production of what? These cytokines. So what are those cytokines? So there are a lot of cytokines that we'll be talking about. Okay, we'll come back to them under chronic inflammation and other other important future lessons. Okay, we'll come and talk about them. So what are these cytokines? So examples of good cytokines that we know, we've been talking about this. So we have what we call interleukins. Okay, we have what we call interleukins. The famous one is what do we know that? We know about what? Interleukin 1. Okay, interleukin 1 is synthesized by like leukocytes, a lot of leukocytes, macrophages, neutrophils, eosinophils, basophils. They're going to be synthesized in what? Interleukin 1. So basically, cytokines, one good type of cytokine is what? Interleukins. Okay, particularly you need to know about what? Interleukin 1, because it's a very important what? Cytokine. Although there are others like interleukin 6 and interleukin 8, they are also important like that. We'll come and talk about them in the future. Like also interleukin 12, interleukin 17, we'll come and talk about them. Okay, so now what is the other one? Apart from interleukin, we also know that there is also interferon. Okay, interferon. Okay, let's say like that. Interferon, there's interferon alpha, interferon beta, interferon what? Gamma. Okay, here there are also what we call interferon alpha, beta, and what? Gamma. Here is just we use number 1. These are just important ones: 4, 6, then 8, 12, and 17. Sometimes on 24 or 23, we'll come and talk about them. Okay, so these are very important cytokines, and as well as interleukin 5. I almost forgot about interleukin 5 because it's very important in asthma pathophysiology. We'll come and talk about it. Okay, another one. Apart from there's also another one which we call tumor necrosis factor. Okay, tumor necrosis factor tumor necrosis factor is tumor necrosis factor alpha, beta, like that. Okay, then the other one is cytokine that we can talk about is what? Transforming growth factor beta alpha, like that. There are also beta alpha. So these are what? Cytokines that you need to talk about. These are examples of cytokines. We'll come and talk about them in what? Future. So for now, let's just know the most important ones. Interleukin, like 1. Okay, like that. These are very important. Tumor necrosis factor alpha. These are very important ones. Okay. So these are the things. So make sure that now in the next video we'll come and talk about what? We'll talk about now cytokine. We'll come and talk about this chemical mediators coming from what? Plasma. Basically, we talked about what? Plasma derived what type of chemical mediator. We'll come and talk about the kinin, the blood kinin, all those stuff. So, okay, we'll come and talk about them. So make sure that you study more. All the best.